cardiac arrest is when the heart just stops, and it happens very suddenly. The difference between a heart attack and a cardiac arrest: a heart attack is when an artery supplying blood to the heart suddenly blocks off. And generally, people will be conscious. They will complain of chest pain, often a tightness around the chest or a band around the chest going into their arm. They may feel sick and nauseated and breathless, and they generally seek medical attention quite quickly. Now, a cardiac arrest is different. A cardiac arrest is a sudden event when patients 1 minute are maybe standing up or walking and conscious, and the next minute their heart just stops and they fall to the floor usually, and they need to have urgent assessment and recognition of that this is the problem that is happening. There are around 30,000 patients per year in the UK who will have a cardiac arrest that CPR and resuscitation will be attempted. The problem is that only 8% will survive to discharge from hospital. So it has a huge mortality. 92%, unfortunately, currently in the UK, will succumb to this devastating illness. What the most important thing for us is, as medical doctors, is that we need systems to improve the way in which cardiac arrest is dealt with. And those systems, of course, have a huge component of pre-hospital parts. The first one is recognition. We need to educate people to recognise the signs of a cardiac arrest and call for help. You then want immediate CPR once you've recognised the problem. The ambulance has already been called, you've already got help, and there'll be help on the telephone usually to help you do the CPR, and you want someone or a paramedic to bring an AED to you as quickly as possible to give you, if you like, the best treatment at the side of the road. And in an ideal world, what you would want to see is that when the paramedics arrived, that your patient is now back in normal rhythm and maybe starting to make some noises and some movements and breathing for himself. And the more people we can educate in those 3 steps, I believe the more people will come into hospital with a better outcome. CPR is vital because what CPR does is buy you time and buy the brain some blood supply. Because what that does is that compressing on the heart just keeps the heart pushing blood up to the brain. It might not be perfectly oxygenated, but it is blood going to the brain. And what that does is you're waiting essentially for expert help to come, and you're waiting for that defibrillator to come to shock that heart back to normal rhythm. The key thing is getting a generation, a society of people that can and know how to do this. And I think we only have to look to our partners across the sea in Holland and in the Nordic countries. They've been doing CPR in their schools since the mid-80s. And their survival rates are triple or quadruple ours. So a defibrillator is basically, it restarts the heart. It's important to have defibrillators everywhere, and there's some very nice evidence suggests that we should have a defibrillator essentially every 500 metres, so every sort of half a kilometre, so that if anything happens to anybody, there is one within a reasonable reach. A lot of people are not trained to use a defibrillator, but the bottom line is, even if you're not trained, this is a very, very simple piece of equipment that can never harm a patient. The AED is just one part of the solution, an important part of the solution, but at the same time we need to have the training, the education as to how to use them and where they are. Defibrillators are around about £1,000. If JE3 Foundation can raise funds to put defibrillators in every gym or support that process, if it can raise funds to support training in every single football club at grassroots level or in rugby clubs and cricket clubs, then you can only imagine that this generation of lifesavers is going to be much further down the line and much further along to prevent unnecessary death. If we can change our outcomes from 8% survival to, even if it's 15, if it's 20% in the next 5 years, which I think is very, very achievable with a programme of training, education, CPR and AEDs, then that would be truly something fantastic coming out of truly something tragic. We just need to up the understanding, up the profile of this terrible condition and the simple things that any of us can do to save a life. And I think that's an incredible message.